I'm going to have to hustle up. So you also want to shift the pattern if you're a night owl, for instance, and you can use melatonin judiciously. And this is in the slides, which will be published as part of the slide set, and you can kind of take this home. So I've just saved you $500, for your consultation with a sleep doctor. The sleep doctor is going to tell you to take the melatonin 0.5 milligram to 1 milligram 3, 4, 5 hours before you go to bed. So just try that. Yes? Yeah, you know what 10 milligrams is? Yeah. It's an elephant dose.
Oh. Well, I took it and felt nothing.
Yeah.
I had trouble sleeping.
Everybody's different that way. But 10 milligrams for the typical person is an elephant dose.
Do you run into the case where less than 10 would be effective, but 10 is ineffective?
I cannot say in every case, because some people are less affected by melatonin than others. But the average person requires somewhere between 0.5 milligram and 1 milligram, and it doesn't work right away, but it takes 3, 4, 5, 6 hours, sometimes even longer before it starts to work. So people have this assumption that, because it says on the pill bottle, take this, at bedtime, that it's like a sleep aid. But it's not. It's a hormone that triggers a cascade of events, and then 3 or 4 or 5 hours later, you become sleepy. Okay? All right. Use bright light to tell your body that it's daytime in the morning. So in the summer months, get out and take a walk first thing in the morning. Open the shades. Get out for 5-10 minutes. That's all it really takes in that intense. Even cloudy days are much, much brighter than it is indoors. Your eyes adjust, but it's probably 10 to 20 times brighter outdoors on a cloudy day than it is indoors. So bear that in mind. Okay. And then you need to maintain the new pattern. So you want to limit your bed to sleep and intimacy. Make the bedroom conducive to good sleep. Maintain that consistent wake time. And let your body know when it's morning on a regular basis. And you'll be able to maintain your good sleep pattern, okay? How does fibromyalgia affect sleep? Well, it's worsened. Sleep, pain, of course, is worsened by a variety of factors, right? Many of these. And we don't have really the time to belabor these and spend a lot of time. I'm sure that Dr. Brown did a reasonable job earlier on that. And treating pain during sleep is no different than treating it during the daytime. And if you're seeing a pain specialist and you're still not feeling right at night, then you should probably let your pain specialist know that something needs to be done for the bedtime dosing to bring that under slightly better control, okay? Of course, you want to avoid triggers for pain, such as movement and excessive pressure. And this is where the good mattresses come in, right? Yes, it does make a difference between one mattress and another. I'm not a pitch man for mattresses. There are lots of good ones out there. The foam mattresses are fairly good for some, although some fibromyalgia people don't like them because they feel like you kind of sink into them and then you can't move and then it feels kind of concrete-like. If you put a soft, like a pillow top over top of the foam mattresses, they often work better, okay? The air mattresses, the Sleep Number ones, they've gotten favorable reviews from many of my fibro patients, and I don't get any kickbacks from them, so, all right. Comfortable supportive mattress. Treat the sleep disorders that result in movement. So apnea and nocturnal leg movements are often resulting in thrashing and moving around, okay? Warm baths before bed help relax the body and reduce the tendency toward movement. So if you can take a hot soak before bed, that's very therapeutic for good sleep, okay? How can sleep disorders affect fibro? Well, it turns out that obstructive sleep apnea is a very common sleep disorder. I'm not going to belabor, but you can see the normal person on the left and the person whose tongue and palate are squishing the back of their throat and getting in the way of breathing. This person has sleep apnea. I had a picture of somebody who suffers from apnea. Suffice it to say that you see those flat lines, sort of the third from the bottom. There's like squiggles and then flat lines, squiggles and flat lines. Those are breaths, and the red lines are 30 seconds apart. So this person is holding their breath for 60 seconds at a time. And then when they resume breathing, those two lines with the marks every so often at the bottom are leg movements. So then when the person resumes breathing, they move because their brain's telling them somebody's smothering you to death. Do something, okay? Well, if you're unfortunate enough to have both sleep apnea and fibromyalgia, every time you move, it's going to hurt. So then you arouse yourself from sleep. So that's the rub, okay? So It increases inflammatory proteins. It makes you move, which increases the pain, increases adrenaline, cortisol levels, interfering with healing, right? So therefore, it's good to get apnea, be screened for apnea if you think that there are any risk factors for it. And I think most people with fibromyalgia should be screened for apnea. Okay, I'm going to skip through that. So you say your sleep problem's more complicated? Well, then find a sleep specialist. And there are lots of good ones around, okay? The key is to find a sleep center that has a broad range of experience, that they don't just treat breathing, that they treat insomnia, leg movements, and that they may be familiar with patients with, with pain syndromes. And most sleep centers that are accredited by the American Academy of Sleep Medicine fall into that category, okay? So in summary, you need both quantity and quality. Fibromyalgia interferes with both quantity and quality. It also leads to decreased activity, which increases the risk for developing apnea and other poor sleep hygiene habits. Most cases are best treated behaviorally. I listed a good book, No More Sleepless Nights. It'll be in the slide set, okay? So get yourself a good insomnia book if you're bothered by it, and you can review those. Those behavioral therapies should be just about in any insomnia book, okay? Over-the-counter natural sleep aids, such as valerian or, Calm's Forte or any of these, they're not harmful. They're great, and they often work very well. Okay, so don't be afraid of taking them. I would steer away from sedating antihistamines like Benadryl, Tylenol PM, those kind of preparations, because they can sometimes paradoxically make your sleep worse. If you're unfortunate enough to have restless legs, they'll make the restless legs worse, and then you can't fall asleep. Okay, and then if the do-it-yourself methods fail, talk to your primary care doctor, get a referral to a sleep specialist. That's what we do. Okay. Thanks, guys. Any questions? I think we answered a lot of them on the way. So I'm around afterward. So, yeah.
I was going to say, kind of off the subject, but what is the relationship between healthy sleep and dreaming? Is there one helping other, or is it two?
There's not much relationship. Everybody dreams, but many people don't recall that they dream. Okay. So that's really the key, is that you can have perfectly healthy sleep and yet not recall your dreams at all, and vice versa.